And thank you for joining us today on this Monday as we begin a new week and discuss what is going on in our county as it relates to COVID-19. The mayor will share latest information on COVID-19 testing here in our county, CARES Act funding, small business, eviction diversion, and some information on magical dining. I think we all like magical dining. City of Orlando Mayor Buddy Dyer is here to discuss all things COVID-19, a new rental assistance program that's taking place in the city, other information as well. And from the Florida Department of Health here in Orange County, Dr. Raul Pino has a look at our COVID-19 data, how it is trending here in Orange County, and other quantitative information to share. We start, of course, with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you all for being here. As we begin this week, I just want to call to your attention that we're heading into the peak of our hurricane season. And there's still a couple of tropical storms that's out there, quite some distance away at this point, but we continue to monitor those efforts. And our Central Florida Task Force 4 team remains there in the Louisiana area in response to the current situation that they have there. So going forward, I do believe that we're well prepared to deal with whatever may come our way. We understand that the next named storm will be Nana. In my household, that's what my grandchildren call my wife, Nana. As for the goals for this week, each week I try to begin with just a summary of some of the goals. And this week, of course, we will continue to ensure that we have adequate testing within our community. We will continue to make certain that we're providing support to our families and to our small businesses through our various crisis assistance programs. And we'll continue to educate our public about the benefits of wearing masks here within the community. You're going to hear today, hopefully, a bit of better news about the numbers here within Orange County. They have declined, but our goal is to make certain that those numbers continue to decline as well. Orange County now has 57 coronavirus cases per 100,000 residents. It is the lowest number of cases per 100,000 that we've seen since June. So that's relatively good news for our community. Also, last week we had a weekly total of 799 cases. That is the first time that Dr. Pino tells me within the last 11 weeks, we have had fewer than 1,000 new cases in 1 week. Our 2-week positivity rate is 5.2%, and all of that really indicates promising numbers for us within Orange County. Since the beginning of the pandemic, Orange County now has a total of 35,902 COVID-19 cases, so just under 36,000 cases. We had an increase of 143 cases from yesterday. Again, 377 individuals have died as a result of the virus within our community, and we always make certain that we honor those who have lost their lives to the pandemic. But when I think about it, really across the nation, we have seen some people, some prominent individuals who either have died or who have been hospitalized as a result of the virus. Of course, one we know reported that Herman Cain is one that died reportedly of the virus itself. But even here within Florida, we have individuals like Representative Chris Latvala from the Largo or the Pinellas County area who has been hospitalized. We've had Representative Randy Fine from Brevard County who has been hospitalized. And so what I'm suggesting here to all of you is that take this virus serious. Please mask up. We have endeavored to make certain that we continue to advocate for the wearing of masks within our community so that we can protect one another. We are doing everything that we can do. We have embarked upon several different campaigns within our community. We partner with Onyx Magazine and other local media outlets such as those with TV, radio, outdoor media, and even print media to promote our Safer, Stronger, Together campaign in multiple languages, as well as the We Got You Covered campaign that we kicked off last week as well. So you should have seen some of the materials that we have disseminated for all of those campaigns. You can get more information from ocfl.net/we got you covered. Orange County Health Services will begin free testing on Wednesday of this week, and it will go through Friday at our South Orange Youth Sports Complex from 8 a.m. to 1 p.m. They will be testing individuals, including minors age 12 and up, who are there with a parent or guardian. You can make appointments by going to ocfl.net/SouthOrange. For a complete list of testing sites throughout the county, please visit our Orange County website at ocfl.net/COVID-19. In terms of the CARES Act funding, the allocations are going very well. They are reaching many different communities in all segments of our community. We are also working with our nonprofits in this area to provide the needed assistance. One of those nonprofits is the Orlando-based Clean the World, which works to improve global health through access to soap and water. Clean the World received $250,000 in CARES funding from Orange County, and they used the money to build a spacious, air-conditioned, 4-stall mobile shower unit, which is being taken throughout the county into unsheltered, homeless population areas. That mobile shower unit will also partner with community organizations and will include critically needed services for rapid COVID-19 testing, vaccinations for hepatitis A, and other services. The unit helps our vulnerable population get the information and resources needed specifically during the pandemic. Our eviction diversion program is going well. As you may recall, that we allocated $20 million to that program to support landlords and tenants in avoiding evictions. Over 1,300 landlords have submitted applications, and nearly 1,500 tenants have also applied. Tenants must be in imminent danger of being served an eviction or potentially served an eviction notice. This program does not apply to those with mortgages, only those who pay rent. Landlords and tenants must agree to participate and meet the requirements of the program. You can call 311 if you have questions, or you can go to our website at ocfl.net/eviction diversion. As we talk about crisis assistance, I bring your attention to the individuals and families crisis assistance that we have been providing. We received some 29,000 applications for that program, and to date about $29 million has been approved for those affected by the coronavirus. In terms of small business grants, nearly 5,200 local small businesses are receiving $10,000 grants, totaling at this point $48.4 million has been approved for payment to small businesses with 100 or fewer employees. With our micro grant program, those are for home-based businesses, sole proprietorships. 533 small businesses have been helped so far through this program, with the average grant just over $2,400. Just as a reminder to help our restaurants, we have begun the program of the magical dining here within the Orlando area or region. It started last week and will run through October the 4th. Diners who participate get 3 courses, and money from the program benefits Feed the Need Florida, which focuses on feeding those who are struggling during the COVID-19 pandemic. And in terms of safety measures, many of these locations have committed to making certain that they have appropriate sanitation measures in place. For more information about those restaurants that are participating, you can go to orlandomagicaldining.com. And I'll turn it over to Mayor Dyer at this time.
Thank you, Mayor Demings. I know today's Monday, but this weekend is the Labor Day holiday weekend, so I want to stress to our community how critical it is that we continue to make the right decisions to keep ourselves and everybody around us safe. If your plans for the weekend don't involve wearing face coverings or social distancing, I would encourage you to rethink those and help us to continue to reduce the spread of COVID-19. As Mayor Demings has suggested, we've made significant strides in slowing the spread of the virus over the last several weeks, so let's make sure that we keep moving in that direction. As we move through this crisis, we want to remember our residents that are most in need. At this coming City Council meeting, which will be next Tuesday, we're going to vote on dedicating some federal funding that the city received directly through the CARES Act to further help those experiencing financial impacts. The funding will allow us to partner with Heart of Florida United Way to launch an additional rental assistance program that will provide $1.5 million in total to residents. And these grants will be for city residents. They'll be up to $10,000 per household to pay past due rent and late fees. We estimate we'll be able to help out close to 300 families. It'll be on a first come, first served basis. You can go to orlando.gov/COVID-19. The portal to make requests will open on Wednesday, September 9th at 8 a.m. And again, it'll be a first come, first served basis. Our transportation partners continue to play a key role in our response and recovery. Back in March, Link suspended all fares to help residents experiencing COVID-19 impacts. Ridership has been reasonably steady since regular service levels returned in mid-May. Tomorrow is September 1st, and Links will be reinstating fares on both the fixed route bus as well as the neighborhood Link service, as well as Access Link's paratransit service. Links continues to require face coverings for riders and their drivers. Link's customer service staff is handing out masks for riders who need face coverings during regular business hours. Hand sanitizer dispensers and the buses are cleaned on a daily basis. As our battle continues, we will also continue our testing, and Wednesday, September 2nd, we will be again at Camping World Stadium from 9 to 1. Dr. Pino.
Thank you, Mayor. Good afternoon, everyone. Thanks for him being here. Mayor Demings and Mayor Dyer mentioned some of the data. So yesterday we received 2,400 negative tests. We received 143 positive tests. That gave us a 5.6 positivity rate for yesterday. And also last week was a negative growth of about 26% with regard to the prior week. And as the mayor mentioned before, that was the first week in 11 weeks that we have less than 1,000 cases. We have over 700 cases last week. We also, all our data points are going in the right direction. As I mentioned to you, the death rate will be the last of those data points to decline, and it is declining already. So that's a good sign. Although it does not have the same feeling for those who have lost the 7 family members that we have lost since we talked to you last. And those individuals were in the age range of 55 to 93 years old, 3 black, 1 white, 1 unknown race, 2 female, 2 male, 4 non-Hispanic, 3 of unknown ethnicity, and 6 have pre-existing conditions. Another important update that people always want right now is also the schools. I want you to listen because this can get a little bit confusing. We are going to start, besides talking about differentiation between isolation and quarantine, we are going to start talking also about confirmed cases. For us, a confirmed case is someone that has a PCR test. So even with those cases that may have a rapid test, we would like to follow up with a PCR test for those who are positive. Because much better, but some of the rapid tests still have some false positivity rates that we would like to exclude if we can. So with this, I'm going to give you two numbers. I'm going to give you the number of people that were positive before we start face-to-face and the number of people that has been positive since we start face-to-face. So for the total of confirmed COVID-19 students, as of today, we have 30, one in private setting and 29 in public schools. At the start of the face-to-face, since the start of the face-to-face, we have added 16 students. So we had 14 at the beginning of the face-to-face. For the staff, we have 23 confirmed cases right now. I don't have the ability to look into teachers or non-teachers. Until we interview the individuals, we would not know that. So that is why we are giving you staff as a general category. And at the beginning of the process, there were 0 on the staffing that we knew, and 10 of those confirmed cases are on campus, work on campus, on different schools on campus. Now, in total, we have 143 individuals that has been placed on quarantine. That is in 9 schools. We added 4 since we talked to you last. I think there were 5. And we also have the schools. 8 schools, 8, not 9. East River High School, Piedmont Lakes Elementary School, Lakeview Middle School, and letters were sent to College Park Middle School and Young Elementary School on the 27th, and letters were sent to on the 28th to North Lake Park Community Elementary School and Sunset Park Elementary School. Those are the schools that at least have 1 or more individual on quarantine. And with regard to the students, and I want to make this clear, please remember that risk is assessed differently in different situations, and it could be that we have decided to expand in one school and have less students in another school. Just to give you an example, if we have the seating chart, it's a lot easier for us to determine how many, because we go 6 feet, 6 feet, back 4 diagonal, and left and right. And that will help us a lot. Another thing that helps a lot is when the students are staggered and corralled when they are having lunch in the cafeteria, because that is a place of a lot of interaction. So having the students sit by class and stagger in different layers will help us in deciding this process, and also to try to be as surgical as possible, but we need to be as aggressive as needed to curtail the transmission of the virus. So far, so good. The county is in a very good shape, and we would like people not to take this lightly. A holiday weekend is coming, and we know from Memorial Day what can happen if we let our guard down. With that, I will answer any question that you have. I pass it to the mayor. Mayor.
Lauren has a question.
Lauren,
Mayor, reading minds.
you are going to get me in trouble.
Lauren Seabrook, Channel 9. Just a couple of questions about the schools that you just mentioned. So far, has there been any evidence of any secondary spread with any of those cases? And also, when you talked about the difference between the rapid tests, are you saying that these numbers you gave are just the confirmed cases? Do you have some who have taken a rapid test, you just haven't been able to follow up with those other tests? And I guess, do you have the rapid test yet?
Those are many questions. Let me take the last first. The rapid test, the process is moving. The contract was signed today. I saw the signature by the state and by the company. We are waiting for the signature from the NBA, and delivery should be happening. So we continue to be optimistic that we could have it this week if things move the way that they should. With regard to the test, so anyone that we have a test for in the system, we will count it. But in the case of rapid testing, we would like to have confirmatory tests if we can. And then that goes to the secondary transmission question. So we have a teacher that there is a possibility that the person acquired the disease from a student. But the person had a rapid test. In that rapid test, that one specifically we had some concerns about false positives. Not that we are doubting it, it's that we would like to confirm it because it's a serious statement that we will make after we can confirm that. So we want to be 100% sure. So we have offered the teacher to become and get tested, and we will try to achieve that.
So because it's just one student, one teacher, not closing down the school yet?
Yes, you are correct. But we will have by PCR.
Steve Hudak from the Sentinel, and this is for all of our panelists here. The numbers continue to go in the right direction. Yet we've opened schools, we had soccer, we've had things that are starting to open up more. What do we need to do now to get to where, we can move to another phase, I guess?
So the phases will be decided by the state. But with regard to the county is right now in very good shape. Even though the schools opening impact, if it's going to have some, it will not be yet manifesting itself. That will happen by the end of this week or by Wednesday next week. If we go by the number of days that the transmission and you start seeing cases. And again, we are going to see cases in the school system as we have seen it. Well, what is going to be the real measure is how can we contain and interrupt transmission? Are we able to act quick enough to be surgically removing students, teachers, employees that may become positive because it's in the community? Now, it's a lower percentage that allow us to have the luxury, if you want to call it somehow, to be more thoughtful and have the time to engage in the process. When you have 1,000 cases in a day, you just can't do anything but just analyze the data. But in this case, because we have low numbers and the school just started, and we are deeply, deeply engaged with the Board of Education, the superintendent, and the health services, everyone is deeply, deeply involved.
From my perspective, it's pretty simple. Just continue to follow the advice of the healthcare professionals. Wear masks, wash your hands, socially distance, do all the things that have allowed us to curb the spread of the virus over the last couple of months. And I know there are people that want to deny that wearing a mask in any way inhibits the spread of the virus, or maybe they just don't care. But the proven science is that you're 6 times less likely to spread the virus if you're wearing a mask, or if at least one of the 2 people that are interacting are wearing a mask. So wear your mask.
I think the only thing I would add is that it's probably too early to draw broad-based assumptions about, whether there's been any impact from the opening of schools, the other types of things that you have seen open recently. We're just going to have to wait on the data to come in, and so the data will drive, I think, a lot of the decision-making. We do not want to be premature. I think after the first wave, everyone got really excited about the potential for reopening, And perhaps there were some businesses that reopened that shouldn't have. We weren't prepared for that at that time. So I believe going forward, we have to let the data tell us whether or not we are hurting ourselves indirectly by the reopening of various segments of our society. The goal, however, is to get businesses back reopened, but in the safest manner that we can possibly do so. Okay, other questions?
Hi, Valerie Boyd with Fox 35 for both mayors. As the numbers decrease, is there anything you're both doing to try and get ready for if and when we get to phase 3? Trying to get those businesses back to normal, trying to get to full capacity, those types of things.
Well, you've heard us talk about the compliance teams that we have out, the strike teams, if you will, that have now visited, I think by this afternoon, some 1,700 different businesses would have been visited. Overall, we now see 92% compliance rate, including those that we have had to revisit on a secondary basis. And we have seen once we revisit the businesses, they generally comply. This week, we will be going to some larger types of businesses and doing some visits and inspections from them. So I think compliance is going to be important to giving us, again, the type of desired outcomes that we're looking for.
One additional thing that we've been doing is meeting with businesses that aren't currently open and encourage them to create reopening plans, not just do it ad hoc, but actually have a plan that they can refer their employees and their customers to. They're working some with the Orlando Health team that's been willing to work with businesses. So some of those types of businesses are bars. We don't know when the governor's going to lift that order, but what we have encouraged the bars to do is to have a plan that would allow them to open safely when and if they're allowed to do that.
Hi, my question's for Dr. Pino. Hi, Dr. Pino. I'm Nikki Zizazo with News 6. So my question is, what kind of medical training do some of our high school coaches and volunteers have who are going to be overseeing our local athletes moving forward?
I don't have an answer. I don't know what kind of training they have.
Scott Howard is here.
Oh, Scott is here from the schools. Do you want to answer that question? Yeah.
I didn't hear the full question.
What kind of medical training the coaches and have for the athletes?
Yeah, in light of the fact that they're going to be overseeing these athletes and going out there, I mean, in these times, what kind of precautions have been put in place in terms of the training they have since they'll be responsible?
Well, so the training's been ongoing with all of our teachers, anyone who's been associated with our students during this time. We continue to train them and bring them up to speed on latest ways to identify their needs as we move forward. A lot of our coaches will be directly overseeing the cohorts of athletes, the football players that'll be cohorted, and we'll have teachers and coaches that'll be doing that and working directly with our school health services folks.
Marvin Washington News. This question is for Mayor Buddy Dyer. Your reaction on the NBA players wanting to use the Amway Center for a voting place?
So we've had ongoing discussions with Supervisor Cowles and the Orlando Magic related to early voting and the possible use of the Amway Center, and we haven't finalized anything, but you guys will be the first to know if we do.
Hey, good afternoon. I have a couple of questions for Dr. Pino coming from Sierra Putnam with WFTB. OCPS announced the plan to have varsity football players do the launched ED or cohort during the season. Do you believe any other sport should follow suit? If yes, which ones?
Well, it will depend. It will depend. I think the school is, the Board of Education is following the advice of the medical board, the advisory board that was in place, and they suggested, which I think is a wise idea, to cohort the football students, especially because it's a high contact sport. And the ability to control any outbreaks that you may see there would be better, and also preventing on from spreading into the larger population of the school. So that was a very wise decision. I think that if it works, which I think it will work, as many parts as possible should follow, when possible, that type of advice. And it's the same protocols that, I mean, to a degree, in a smaller scale, of course, that the NBA has put in place, and is to place this bubble around the players when we can. And we are in conversation to see how often we can test the student, if they need to be tested, and we will engage with the Board of Education in supporting their initiative to do so.
I have one more from Sierra Putnam for you, Dr. Pino. Before school started, you mentioned that there were 10,000 COVID tests available for schools. How many of those have been used, and has the county or district obtained additional tests?
We have access to any amount of tests that we need right now. And for the testing that we have used, I believe we did 20 cases on Saturday, and we did 15 on Friday. And when I was briefed this morning, there were 12 scheduled for today. So the testing site that we are doing at Lake on the Hill area, it is designed to offer teachers and students that choice. If they choose to go any other place, they can do. If they went already and got tested, that's absolutely fine, but we want to facilitate that process. Another thing that we got a request today from the school board in our early communication this morning with the superintendent is to see if we can allow the teachers, if we can talk to the state to allow the teachers to go into the first responders line so that they can be tested rather quick and return to work if they need to. So we are engaging.
Great, thank you. My next question is also coming from Sierra Putnam for Mr. Howitt. OCPS announced that plan to have varsity football players do launched ED or cohort during the season. How many players have decided to cohort at a school? Who is going to oversee that room of football players? Coaches, traditional teachers, substitutes?
So we already had about 50% of our football players had already been at home, doing launch ed at home. The other 50% will be moved into the cohorts, and they'll be supervised, overseen by coaches, teachers, all of the above. It'll really be a principal decision at the school level.
I have one more for you, sir. Besides football, volleyball also has contact. Is OCPS planning to cohort athletes in that and other sports this fall? Why or why not?
Well, we'll certainly look at it. Like Dr. Pino said, the medical advisory board has been advising the school board and the superintendent as to direction to go. I think volleyball was one of the ones where they said that they would prefer that they wore masks during competition in order to prevent any potential spread. That's not as high contact as football, but it's a start. They will look at opportunities where they can to cohort athletes together in order to keep them together during that time. So,
thank you.
Yep, thank you.
And I have two questions for Mayor Dyer. Mayor Dyer, this is coming from Dave Ross at Rewesh. He wants to know, what is the reaction to NBA players wanting to use the Amway Center as a polling place?
Same answer as before. We've been in discussions with the Magic, our venues team, Bill Cowles, about using the Amway Center as an early voting site. So we haven't finalized anything, but hopefully we'll have some type of an announcement before the end of the week.
Okay, and I have one more for you, Mayor Dyer. This is coming from Ryan Lynch with the Orlando Business Journal. For Mayor Dyer, besides the individual assistance, is the city currently considering other potential uses for its remaining CARES Act funds?
This is the remaining portion of the CARES Act funds that we have. We have the ability to obtain additional funding through the county, but we haven't come up with a program to be able to access that right now.
That concludes the questions.
And the only thing I'll add is in terms of the CARES Act funding that you hear me speak of, it includes individuals who live within the municipalities. So it's a countywide program. Okay. All right, if there are no other questions, then this will conclude our press conference at this time. We do have Commissioner Uribe and Commissioner Gomez Cordero who are here. any of us are available for one-on-ones if the need arises. Thank you all for being here.